Hello, everybody. My name is Bryan Torres, and I'm currently one of the VRIP interns for summer 2022 here at Harvard Medical School. And I am currently also writing second year at Tulane University School of Medicine in New Orleans, Louisiana. This summer, I've had the honor and privilege to be able to work with Dr. Hester Ortega, who is currently a surgeon scientist, specifically a general surgeon for the Brigham and Women's Hospital for the Center of Surgery and Public Health. And my project specifically this summer is being able to help characterize what we are trying to define as language serving hospitals and looking at patient reported outcomes, specifically for patients who are non English primary language speakers, and see some of the patient characteristics, hospital demographics, and characteristics, as well as the reported outcomes for hospitals that are going to be classified as language serving versus non language serving. The best part of the internship for me so far has been from start to finish. The day I applied, I was very excited because not only was I going to be at Harvard affiliate institutions, but I was going to be able to be part of a cohort of people that were going to be my peers from similar backgrounds and experiences. And that to me is very important, especially as a minority in medicine. I wanted to be surrounded by people that look like me or have shared similar experiences. Um, During a journey, it can get very lonely. So I feel for me, it's very inspiring to be able to be surrounded by people who come from all walks of life and from different institutions to be part of my cohort for the summer. Secondly, I'm very grateful for the opportunity to have an amazing support system for program director, Dr. Mary Frances Lopez, as well as Ms. Jessica St. Louis, from start to finish again, from the day we interviewed and to the end of the program. They have not only made out a schedule that's dedicated for us to be able to learn how to grow professionally and personally, but also has given us the honor to be able to meet a lot of very known faculty and professors at Harvard institutions, as well as being able to give us the dedicated time to really push us out of our comfort zone, to network and get to know other faculty members here, to be able to not only help bring us back to Harvard if we choose to, but also help us best prepare for our future endeavors or whatever we decide to pursue. And I think it really pushed for trying to showcase the power of networking and being able to have the support when I was able to reach out to a lot of these faculty members. And lastly, but not least, um, the most amazing part of my has been able to be able to work with my mentor specifically, Dr. Hester Ortega. As a first generation Latino, I've always aspired to be able to be part of getting to know someone who looks like me in medicine. Um, but it's very hard because a lot of times there's not a lot of Latinos in medicine, and even less of those who are in academic medicine, and even less of which are surgeon scientists and researchers at institutions such as Harvard affiliate hospitals. And so for me, from the second that I met him, not only did he look like me, but he had very similar background, very similar experiences, but more importantly, had a very similar mission. Not only to be able to diversify medicine and to be able to be a mentor to the next generation, but to do research that was really dedicated to be able to help some of the most vulnerable marginalized populations. And for me, that's always been very inspiring because I've always strived for the similar goal. But to be able to meet somebody firsthand um, in front of me and being able to not only get to meet him but work with him has been one of the greatest honors and privileges. I'm very, very grateful to not only have been able to work with him and learn from him, but to have hopefully a long lasting, never ending relationship with him as we continue to work together in future endeavors, but also with similar goals. We're trying to be that mentor and leader for the next person that comes after me. Um, so very grateful. And one more thing that I want to say that has been an amazing part of the internship is being able to meet other students, medical students who are doing similar programs to other Harvard affiliated institutions, and being able to see that there's a lot more of us here than I thought that are underrepresented in medicine. And so being able to get to know them, get to explore Boston and be able to do a lot of great things together has been amazing. Because now a lot of these people have been able to not only become new acquaintances but friends, but I really do see them as eventually long-term family. The world of minority medicine is very small, so I'm very grateful for the opportunity to bring us all together. Thank you, Harvard Medical School and affiliated hospitals. As of now, my future career plans is I'm currently interested in surgery, specifically surgical subspecialty of plastic and reconstructive surgery. Still open-minded, but that's kind of what I'm learning towards. I do envision myself as an academic surgeon scientist who dedicates his life to kind of three things. One of which, on a clinical setting, is I want to be able to be a clinician or a surgeon that's going to predominantly serve uh, populations that are the most vulnerable and marginalized. I want to be an institution that will allow me the opportunity because, for me personally, I identify with that group, and so for me, that was a lot of the reason why I was inspired to go into medicine. and I've always wanted to give back to my community and serve the population, especially with specialized surgical care that a lot of times patients don't have access to or adequate access to it. Secondly, I envision my life being a scientist, specifically does research that will predominantly serve communities. I like big system community public health research that will not only address and help find some of the unmet needs in the community, but be able to go back and serve the community directly to me that I'm going to be working and serving. I like that the idea of knowing that um, the research that I'm doing is going to be going back into the people that I'm basically going to be seeing every day in my institution. Lastly, I see myself continue to be that mentor and leader, and as a professor, I want to be an academic center so I can not only teach next generation of physicians things that go beyond the textbooks, but also try to find ways to continue to mentor and lead the next generation to show minorities that it is possible to be a minority in a white coat. Diversity in medicine to me means being in medicine and having the representation and inclusion of individuals from all walks of life and all life experiences that can help us better serve the patients that we see every day. To me, it is very significant and important to have diversity in medicine because without it, we are not adapting to the populations that we serve, especially those that are the most vulnerable and marginalized and systemically oppressed. So for me, I feel like we all come from different life experiences and walks of life that regardless of how we look or how we identify or the shade of color that we all have something to offer in the field of medicine because we all do not walk the same line. Whether someone looks like me or doesn't look like me, we all have different life experiences, and life to my eyes is different than the other person. And it's very critical to have that person's perspective and opinion in medicine because when as a future health provider, even though I might not have experienced that personally, I want to be able to learn from my peers and my colleagues so I can be able to better serve a patient who they can relate to, better identify with, who has that life experience before. As a first generation Latino from a low socioeconomic status, I a lot of the inspiration of why I wanted to go into medicine was because a lot of things that I faced early on, a lot of social barriers that me and my family faced. And so even though that presented a lot of challenges on the journey to get to medical school, it allows me to better connect with my patients and the people that I serve to help them know that I understand them and I can relate to them. And even though someone might not have that, at least they have the ability to be able to learn. And this is why diversifying in medicine is important. These conversations, these experiences, these life lessons can be taught to future generations of physicians and the patients that we ultimately serve.